Hi, my name is Ryan Hobert. I'm the Managing Director of the Climate and Environment team at the United Nations Foundation. I saw the impact malaria has firsthand when I lived in Africa in the early 2000s for 6 months. It was all around me. I saw people get sick, and I myself got it and got quite sick despite the fact that I had medicine, unlike some of the folks around me. So I know how prevalent it is, and I see how destructive it is for populations who have very little resources to combat it. We're getting a clearer and clearer picture of the relationship between climate change and malaria, and it's not a good one. We know there was just an article a few days ago actually in the Washington Post that showed that up to 5 billion people would be exposed to malaria by 2040. And that includes not only places in Africa, for example, that where malaria is endemic, but in those situations, people are exposed to malaria for much longer periods of time, whether that's because they're getting increased storm or temperatures are higher, but also in places in Africa like the Horn. We are just now really starting to grapple from an advocacy and policy perspective with the interaction between climate change and health. For example, this is the first year that at the Climate COP there will be a dedicated health day. WHO just nominated Vanessa Carey to be their climate envoy. More and more, we're just seeing more and more activity at the intersection of health and climate, which is critical because one of the greatest arguments for combating climate change is actually the health impacts. But at the same time, I think we really need a lot more activity. We need health ministries to be taking a really deep look at what climate change is going to look like in the future for their own populations. WHO has been committed to this agenda, but they need to really double down on it. And I think vice versa, the climate community needs to be much more engaging of the health community in order to tackle this challenge in a renewed way that's going to be effective over the long term.